Hi, my name is Jana Zwyman, and I am the founder of Mass for Humanity, which is a project that connects organizations of essential workers with people who can make cloth face masks. And as part of it, and as part of our community, we recognize the need to include a lot of information about COVID-19, mask wearing, and the pandemic. And we started this series called Ask a Scientist. Mask for Humanity is a project of the Pussy Hat Network, and we are just so thrilled to be on the Pussy Hat Project's website and Facebook, and also Mask for Humanity website and Facebook. And welcome to everyone who's here tonight. We have with us, we're so excited, Dr. Taylor Winkleman. She is a veterinarian and public health policy professional with experience working in public health in the US and also Bahrain, Uganda, New Zealand, and more. She has written policy on Capitol Hill, and she's overseen federal research in the executive branch. She's consulted for nonprofits and think tanks and is currently the Council on Foreign Relations International Affairs Fellow. Her areas of expertise include One Health, infectious disease, and modeling. She co-hosts the monthly Pandemic Prediction Forecasting Science and Technology Group meetings. She's also the current coordinator and founding member of the Next Generation Global Health Security Agenda, and also teaches science policy and international policy at Georgetown University School of Medicine. We are so thrilled to have her and her perspective and her expertise and knowledge with us today. So I'd like to welcome Dr. Taylor Winkleman.
Hey, Jana, thank you so much for having me.
Thank you so much for being here. And just to make sure we say this, you're here as a private citizen and not representing any specific one of those many places where you are working.
Yes, absolutely. Okay. All views here are my own. But
excellent. Excellent. But based on years of experience, and I have so many questions for you that we've taken from our community, and I've distilled them down into a couple of different ones. So we're going to go over the general basics, but then we're going to talk about the timeline. So sort of short term, we'll talk about voting. A little bit longer term, we'll talk about the holidays. And then even a little bit longer in the future, or hopefully just a little bit longer, what happens when the vaccine comes out. And I feel like those are a lot of the things that people are most, when the amazing vaccine comes out, what that'll actually look like. So I just wanted to start with the fact that we've been living with coronavirus for almost a year, and it feels like things have changed a lot. Can you explain why things seem to always be changing?
So yeah, that's an excellent question, an excellent place to start. And I think there are two reasons why it feels like things are always changing. And one is because we as humans sort of psychologically, we don't deal with long-term stress particularly well. We deal with short-term stress very, very well, or moderately well. But we're not necessarily built for constantly being in emergency mode. And so our own perspective on the risk of something like a pandemic changes over time. When it first emerges, a lot of us panic and are scared and react very strongly. And then as it continues, particularly if nobody that we know very well is affected, or nobody that we know is affected severely, we start to experience quarantine fatigue. And so that is something that's really a sort of fascinating phenomenon to watch. We are entering the third wave in the United States. Europe is entering its second wave. There are first, second, third waves kind of all over the place right now. But people are not panicking at the fact that there are 80,000 new cases a day of coronavirus in the way that they were panicking when there were 500 new cases a day. So that's one of the reasons why things seem to have changed. The other reason why things change is a science reason. And it's because this is a new emerging disease. We knew nothing about it other than the fact that it was a coronavirus when it first emerged. And now, as time goes on, we've thrown a lot of funding at this, right? So much funding has gone towards understanding coronavirus. We're sharing samples internationally in ways that we had not done previously, or that we didn't do as with the same amount of alacrity as we did previously. And so what we are seeing is science live, right? So we are learning
Mhm.
things about the virus, and we are learning new things about how it spreads, and the virus itself mutates, right? There's a known mutation rate for it now. We can kind of predict. We can't predict how it will mutate, but we know that it will. And so as the virus mutates and things change, our understanding of it changes. And so it can seem like everything is changing all the time, when in fact it's our perspective that's changing for two reasons: for our own sort of psychology, and because the science is evolving, we are learning more about it.
Got
Hopefully
it.
that answered your question.
Yes, absolutely. I mean, it feels like we're part of this great science experiment, and we can't necessarily predict. The ending has not yet been written. So all of these people who've dedicated their lives to infectious diseases and immunology and figuring out things, this is just happening so quickly, and we're all strangely participating at the same time.
Yeah. So it's weird being an infectious disease scientist, having been in this field for closing in on a decade now, because all of my coworkers and I, when this first came out and this first started spreading around the globe, this is exactly what we've been talking about for years. We'd been meeting, saying, what happens if? What if Ebola hit China? Right? What if Ebola originated in China is a question that opened many a conference. And one of my coworkers and I were talking about it one day, very early on, about March, right about when the lockdown was about to happen. And she said to me, I don't think vindicated is the right term, but there's some sort of like Pyrrhic victory feeling happening right now, because this is what we've trained for. And I said, I get what you're feeling. It's not victory. This is not a victory. This doesn't feel like a victory, but it does feel like, for those of us who are in this field, a sense of purpose, right? We are useful at this point because this is really happening. And everything that we said that people called us crazy for saying, or that they said that's never going to happen, and we were called doomsayers and all of that, everything that we said would happen has been happening, and not a single one of us ever wanted to be right about it. Every single one of us always wanted to be relegated to the crazy conspiracy theorists who had no idea, who overestimated. And that's the interesting thing, right, about disease modeling. When we do disease models, and I think anybody who's interested in science, this is sort of a fascinating thing. Disease models they do very well with short-term things. It's like predicting the weather. What's going to happen tomorrow, we're really good with, right? We can look at what's going on today. We can kind of figure about this tomorrow, right? If we had 80,000 new cases today, somewhere near 80,000, maybe a few more, probably will be what happens tomorrow. What's going to happen in 6 months depends so much on what we do over the next 6 months that we can't predict. So disease models hold all of those things static. And so disease models will usually say, assuming that people don't change their behavior, assuming that we don't get a vaccine, assuming that we don't start social distancing, assuming that, and disease models are always looking at the worst possible scenario, right? Because we need to know what's the worst possible scenario. And so disease modelers are sort of notorious for always being wrong.
You never want to be right.
You never want to be right, but also it's a model, right? And just like a model plane doesn't have an actual working engine inside of it, a model of disease spread necessarily is a snapshot of just a few variables. And it just can't be as nuanced as reality. And so for me, it's sort of fascinating to see the public response to this. And because it's something that has become sort of the defining moment for so many people in their lives. 2020 is always going to be the year where everybody says, I know where you were in 2020. You were at home, like everybody else, right?
Yeah, absolutely.
And so it's an interesting thing to see, and an interesting thing to sort of see play out in real time. And the things that we were right about, we were really upset that we were right about them. And the things that we were wrong about, we are equally as upset about having been wrong about those things. So it's been an interesting pandemic for everybody.
Everyone. So can we talk about sort of what we know right now as everyday people? Like, what can all of us be doing right now to help control the spread of COVID-19?
So, yes, thank you. Please.
We got the hand washing still very important.
Still wash your hands for 20 seconds. And I think we're actually entering the phase where it's the hardest because we've learned to sort of live with the fear. And so it's not so scary anymore. We're just, a lot of people are kind of like, I can't not live my life. And to an extent that's true, but you can still choose to do things in a socially distanced way. You can still choose to do things and in the safest way possible. Outdoors is always preferable to indoors, right? Fewer people at any one gathering, and don't change those people over time, right? If you're going to change the group of people that you spend time with, take 2 weeks. I know it sucks, but take 2 weeks before you get in contact with a new bubble of people. And that keeps you and everybody else. If everybody's doing this, it keeps everybody safer. I'm actually planning on going home for Christmas. I know we're going to get into the holidays shortly. And when I talked to my family about it, I told them that before I came home, because my family ranges in age from, in the 20s to in the 70s, I'm going to quarantine for 2 weeks beforehand. I will also get a test, right? So it's much like STD testing, right? You should get tested if you are interacting with people. If you are ever exposed to anybody, you should get tested. The window is 5 to 14 days, right? So get tested in that window. And all the same rules that we lived with apply, right? If you can telework, do. If you must work in person, wear a mask, right? If you are going to be in proximity with people, wear a mask. If you're grocery shopping, try to do it just once a week or less, right? And get things delivered rather than go out and get them yourself. Do that. And make sure that you're doing all of these things in a way that is sustainable, because this is not going to be over next week or next month. We're looking at probably, like, we'll talk about this again when we get to vaccines, I'm sure, but we're looking at probably a year before we can really think about it's safe to shake somebody's hand or hug somebody again, which sucks. But it does. The more that we do our part, the more people we will get to hug at the end of this.
And it will feel so good when we do.
It will feel amazing.
It'll be amazing. So we've got wash your hands still.
Wash your hands always.
Always. Don't touch your face. Still a thing. Still right? Because the virus can still be something you touch and put on your facial orifices. Wear a mask when you're not specifically with your bubble, in your bubble, like inside. And physically distant, stay as physically distant from other people as much as possible. So even if you're an essential worker, try to do this as much as possible. If you have the ability to not have to go into an office, take that, that ability and, harness that as much as possible. And then are you still, there was a lot about sort of surfaces. Are you wiping down your mail when it comes in? Are you still doing that? What are you thinking about there?
So I'm lucky. I have a camera. I have a security camera at the front of the house. And so I know when the mail is delivered, and I wait at least 6 hours, usually 24, before I even pick up my mail. If any of it is plastic, which is shown to have a longer survival time, I might wipe that down. Depending, we know that sunlight will kill the virus, right? Not from inside of you, but sunlight will kill the virus on surfaces. So I take advantage of the natural elements and let it, since I have a mailbox that's kind of open, I let the sunlight do that. But yes, if there's anything that I think is going to be handled excessively by other people, like my groceries, I still use Instacart, things like that, I will wipe them down, or I will put them away, throw away all the trash, and then wash my hands. And if there's any like fresh fruits and vegetables, I wash them before I eat them. Like, you don't have to be super anal about it. You just have to be careful. And just think, like, if everything is covered with dirt, what do you do?
Perfect. And just
Right?
keep washing your hands, but not necessarily wear gloves and pretend you're protected, because you still might touch your face.
Yeah, wearing gloves, if you're not trained in how to properly kind of handle gloves and handle yourself while in gloves, it can actually have a reverse effect, because you feel like you're safe, and so you'll touch more things, which can both spread the virus around more things, but can also, you can forget. And the number of times I've seen people pick up their phone while gloves and then like mess with their phone. If you have virus on your glove, you've just put virus on your phone. The number one thing I do sanitize more than anything else is my phone, because I use it so often. And so I just got myself, I actually have them. I just got myself, a little container of like electronic wipes, and I sanitize my phone. Every time I go out and I come home, I sanitize it.
Okay, great. Thank you. Thank you for the recap of where we are and how this is moving. So I asked you about that, and then there's just a lot of questions that we've been getting about where do we see the virus kind of being spread the most? Is it like getting on a plane and one person is on a plane? Does it seem to be at schools, or is it really just where people are?
So that's a really good question, and it's one that I'm hesitant to answer, because it's hard to tease out which activity is the most dangerous at the moment. There's a lot of work being done around that in the modeling community, and a lot of new data that is coming out with the advent of cell phone mobility data. See use some of it. Some people are very afraid of that data being used, which I understand. But the data that I've seen being used has been anonymized and all of that. And it's been a very powerful tool for researchers to look at and understand what human behavior is doing. And if we can measure that, then we can understand which of these activities are really the most dangerous. Coming at it from just a knowledge of infectious disease and how this virus spreads, indoor activities with a lot of people, particularly if you're not wearing a mask, is the number one way that this disease is spread, right? Anything where air is not moving and there's a lot of people that could potentially be putting virus into the air and a lot of other people that could potentially be breathing it in. That's how it spreads. There are nuances with schools about whether or not children spread it efficiently. There are some studies that say that children are very efficient spreaders, even though they don't tend to get the disease or they don't get it very badly. And that there may be something to that. I haven't dug deeply enough into those papers to really feel confident in making that statement assurances yet. And obviously hospitals are a terrifying place. If you don't need to go to the hospital for something, don't. If you can do something outpatient rather than inpatient, good. If not, try to be as patient with your doctors as possible, because I'm quite certain that every hospital is doing increased sanitation and increased care, and it will just make all the services take longer, which is scary.
Yeah.
I promise you, every MD out there is doing everything they can to keep you as safe as possible.
Yeah, and an extra shout out to anyone who's working in healthcare for taking care of all of us.
Yes.
We're just incredibly grateful. And I think, when people, someone has to go to the hospital and they're like, oh, I don't have COVID, I'm fine. Like, when we're talking about people being asymptomatic, how can you just kind of explain for the general public what that means? I think of it sort of what we learned in health class about herpes or high blood pressure. How do you think about that and explain that?
So I think about it, and this is going to sound strange. I think about it in terms of glitter. So if we imagine that the viral particles are specks of glitter, the people who are symptomatic tend to have higher viral loads. So they're the people that got like a face full of it, and you can see that they are sparkly. They are the twilight vampires of COVID patients, right? So you can actually see it. the people that are asymptomatic are the people that might have like 1 or 2 specks of glitter on their cheeks, but you kind of maybe is that glitter on your face? I'm not sure, right?
Mm-hmm.
But if you've ever been in a circus show, a gymnastics show, in within 20 yards of a craft room, you know what glitter does.
Everywhere.
It just gets everywhere.
Mm-hmm.
And if I am in a room with glitter and I get a little bit on me, I could spread it to somebody who's never been anywhere near that room.
Mm-hmm.
And get glitter on them. And so when I think about asymptomatic people, I think about those people who didn't know that they got glitter on themselves and who don't know that they are now getting glitter on other people.
That is such a great way to put it, because you can find glitter a week later in your car and you have no idea where it came from.
Right. And that is the special thing about this virus, right? The incubation period is such that by the time you know that you have it, if you're going to be symptomatic, you have already had so many contacts if you're living a normal life, like a pre-COVID life, that trying to contact trace that and trying to make sure that everybody is okay in that chain is a daunting and scary task, and all of the people that they were subsequently in contact with. And then you start thinking about kind of how many people are in contact with how many other people. And then it starts to get scary. And as like an infectious disease modeler, that's when we start to panic, right? So if you think about it like glitter, and you think about how would I contain the glitter, that's kind of what being asymptomatic is like. If you didn't know you had glitter on your face and you went and hugged somebody, you would definitely get glitter on them, but you wouldn't have known that you were the source.
Got it. And that's why, just to kind of put it out there, wearing a mask is, if you have glitter all over, if you have some lipstick glitter on, you're wearing your mask. And so you're much less likely when you're speaking to project that glitter onto someone else.
Yes, exactly.
Got it. And I've talked with people who are very, there's 2 ways of looking at the mask. One is that it's for public health and you're helping other people. So you're literally potentially saving so many lives if you're asymptomatic and walking around in the world. If you are walking around in the world and wearing a mask, but you're around people with COVID, is that less effective to protect you if they're all wearing lipstick glitter?
Yeah, it is less effective. And it is less effective for multiple reasons. We know the surgical masks I can speak to in particular, because we measure them. When surgeons are wearing masks, they're not wearing them for themselves, right? There's a little bit of a protective effect, but you are wearing it literally to protect your surgical site. And so they are made to keep things that come out of your mouth from going into your surgical site, right? We're trained to be surgeons, and they say, if you have to cough or sneeze, you cough directly at the wound, because what comes out, if anything escapes your mask, it's going to come out the sides, right? So
makes a lot of sense.
Yeah. And so you're still breathing in air. The air has to come in somehow. And it might be more pressure. It might be, just the direction. It is less effective if you're wearing a mask and everybody else is not. It is most effective if everybody is wearing masks. However, there is a new study that came out, and this was fascinating, that showed that wearing a mask, even if other people aren't, but wearing a mask can decrease the viral load. It will decrease the number of viral particles that get to you.
Right.
That will then decrease the severity of your disease if you get it. And also, because you have a lower viral load, decrease your ability to spread it to other people. That doesn't mean that you should just go out if you have COVID or if you've been exposed, but it does mean that wearing a mask is actually protective to yourself. It means that you are likely to get a less severe form of the disease, and or be asymptomatic. And if you're going to get this, being asymptomatic is far better than being symptomatic, as long as you are not putting other people in danger, as long as you're constantly, you're wearing a mask when you're in public, because none of us know 100% for sure that we don't have it.
Yeah. So in the grand scheme, we should all be wearing masks because we care about each other. And so the little bit of a hassle of putting on a mask, you could literally be saving someone else's life, which is kind of amazing. And then if you're in a place where we're all across the country. So if you're in a place where some people aren't really wearing masks and you're a little bit of an outlier, it's still good for you to be wearing a mask because your viral load will be lower. And you're also sending a signal that people wear masks, which might encourage other people to wear masks and take care of other people. Sort of like those two together. Okay, wonderful. Which leads us to a week from today. A lot of us are going to be standing in line voting. And so those are a lot of people we've never met before. We might be in line for hours potentially. What do we do to make that as safe as possible?
So I'm so glad you asked, because voting is such an important thing to do. And I don't want to say that voting is the only thing that you should do, but I love your vote. But coming from the perspective of someone who has worked in public policy, your vote is your voice, and it's very important for your voice to be counted. And I honestly don't care who anybody votes for. I want people to vote, and I want people to participate in the process. Now, there's a wonderful hashtag floating around that's hashtag vote safe. And I really like it because it's SAFE is the acronym that they came up with, right? And SAFE stands for sanitize, appropriate distance, face mask, and early vote. So BuzzFeed actually has a great listicle out right now about when the last day that your vote can be counted if you mailed it in, when the last days of early voting are. I happen to know, because I'm in DC, that in Virginia, early voting is currently open. I believe Maryland actually closed early voting. And so if you haven't voted in Maryland yet, you have to go in person on the day. But if you can vote early, or if you can vote by mail, that is obviously the safest way to do it, particularly voting by mail, right? The least amount of contact you can get with people. There are some questions. I know a lot of people have questions about whether or not that is safe from a voting perspective. And so if you don't feel confident voting by mail, if you can vote early, if you can, and this is a super privileged point, and I'm just going to acknowledge that, but if you can vote at non-busy times, that's fantastic. If you cannot, then bring your bottle of hand sanitizer, wear a mask, and keep your 6-foot distance from everybody. Try not to touch anything in the voting booth that's not your ballot and your pen. Try not to touch too many people, and make sure that if you can, again, get there early in the day. The earlier in the day you are, the more likely it is that there isn't any virus anywhere around. Again, that's a super privileged point. Everybody can do this safely if everybody works together to wear masks, to stay distanced, to sanitize their hands. And we have 1 week left.
Yeah. 1 week. Yeah. And if people are concerned about the post office, depending on what state you're in, because they're all so different, there might be a ballot box. We have one right by our library. There are a lot of libraries have like an extra box right now. You can do that as well. So if you're concerned it won't get there in time, for everyone who's listening, that's really
also have drop boxes as well this year. So you can go to the polling location on election day and just drop off your ballot that's already been filled out. So yeah, all of those are options. I encourage everyone to vote. If you possibly can, I encourage everyone to vote safe.
Absolutely. Yes. It's everyone who has the privilege to vote should be voting, so that we can all know what everyone really wants in our government. And for everyone who's not quite sure about who they want to vote for this presidential election, though I'm pretty sure this has all been clear, your most local candidates, from who's maybe the sheriff to, up to like attorney general, whatever issue you care about, up and down the ballot, it's all up for grabs and is super important here. So thank you. So that's next week. And so going into November, December, and the holiday period, I'm weary. A lot of us are really weary. We miss our family. I'm really happy you're going to get to see your family. And so what's the best way for families who might be flying to see each other, or, haven't been in the same bubbles, but just, driving across the city, what's the safest way to see each other?
So, yeah, no, such a great point. If you can avoid airports, please
Mm-hmm.
do. I am not at all trying to say anything bad about airlines, about what they're doing, about what they're trying to do, but sorry, but there are absolutely more people, more there. You can't avoid getting close to people if you're going through an airport. And so if you are trying very hard to stay safe and to do everything by the book, you would it's preferable to drive. That is not possible for me, and it's not possible for many people who have family in other states across the country and other countries. And so if you are going to fly, look for an airline that preferably doesn't have people sitting in the middle seat. That is ending most airlines before the holidays. And while that's a little bit frustrating from a public health perspective, that's very understandable from a business perspective. The airlines got hit really hard with this. They're struggling to survive. And so it's a difficult trade-off. This is really a huge trade-off. I would encourage everybody to be either extra vigilant about distancing or even quarantine themselves for 2 weeks before they go anywhere, just to reduce the chances that they could be asymptomatic and spreading COVID on a plane, in the airport, if you're getting food on a layover. I've noticed that there aren't as many long haul flights, that they're chopping flights down to shorter ones. And so it's harder to get nonstop flights, which again, if you are going all the way across the country, is a scary, scary thing, because it just
more people,
the number of people that you have exponentially, right? And so if you have to fly, the safest seat is the window seat. I've just guaranteed that there will be no window seats available, right? The safest seat is the window seat. If you can maintain a seat in between you and another person, do it. Sanitize like crazy. Keep your mask on. It is not a political statement to wear a mask. It is a public health necessity. I don't care who you voted for. I don't care who you support. I don't care if you don't vote. It does not matter. Wearing a mask has nothing to do with politics. It has everything to do with public health and keeping each other safe. And I mean, from a scientific perspective, hands down, it is the strongest defense we have against this. That and hand washing. Yeah. And until we have an effective treatment or an effective vaccine, it's what you got to do. So, kind of the same things that we're talking about with vote safe applies for travel safe, right? So sanitize, keep your distance, wear a face mask. If you can travel on not the busiest travel days, try to do that. It's just better. I don't know what the airline schedules are for sanitizing their planes, but if you can figure out what their schedule is, the first flight after they sanitize their planes is obviously better than the last flight of the day.
That definitely makes sense. And what about public bathrooms?
I mean, you can't avoid using them.
But would you just say, keep your mask on?
Oh, always keep your mask on.
Keep your mask on in a public bathroom, even if you want to
if you need to blow your nose, put your mask back on. Dispose of your tissue properly. Wash your hands very, very well. Sanitize very, very well. Touch as few surfaces as possible. So I guess the corollary to that is wear pants when you go through the airport so that you can use your foot to open doors. I'm actually serious. The less you touch things, the better. If you can't avoid using your hand, take a little piece of toilet paper when you're leaving the bathroom and use that to open the door. It just reduces the surfaces that you touch, right? Take a paper towel as you're drying your hands and use that to open the door. There's tons of trash cans in the airport, so you're not going to have any trouble finding somewhere to dispose of your paper towel.
Perfect. Okay, so we've got flying done. So people are driving. So so let's say that flight was perfect, and then this other group is coming to meet by car to somewhere else.
Fantastic.
So all of that's great. They go to the gas station, they sanitize their hands afterwards. But they've spent, you say 2 weeks before kind of quarantining, is little exposure to anyone. But before actually, maybe we should go back to flights. Let's pretend they took a flight. So they've been on this flight. There are like hundreds of people there. We don't know what happened. They get off, they take a shower. But do they have to wait like another 8 days or 14 days before they see their family? Is that, or like an overnight? How do you figure that part out?
So in an ideal world, yeah, you would. In a practical world where we can't spend 2 weeks in a hotel quarantined before we go see our families for the holidays, this is one of those things where you have to make that calculated risk, and that calculated risk needs to be something that you make in consultation with your family members, right? Before I decided to go home, I messaged my entire family and I said, is everybody comfortable if I come home? Here's what I will do before I go. The airport is still an issue. The airport is still a potential contact, right? One of the ways, and this is also heartbreaking, but one of the ways that you can reduce your risk is by traveling for a short period of time. Incubation period still takes a few days to get to the point where you're infectious. I think the minimum number of days before infectivity is 3. I think it's more typically 5. I haven't double checked these numbers today, so don't 100% look it up before you go on this. But if you are going for a shorter visit, that trip through the airport is less dangerous. And then when you get home, then quarantine for 2 weeks after your flight home, because you don't know what happened in those airports.
Got it.
Or get tested, and or both, right?
Yeah. And then when you see your family, should you be wearing a mask as if they're not in your bubble because you haven't been tested and have that kind of time, like post-airport?
That is, again, in an ideal world, yes. In a real practical world, when you haven't seen your family in a year, I'm not about to tell someone they can't hug their mom. I am going to say that is something that if you have somebody in your family that is immunocompromised, that is in a higher risk group, that is potentially nervous about it, if you aren't staying with them and you can keep socially distanced and you can handle that, that is ideal. If you cannot, make sure that everybody knows the risks that you're taking, and make sure that you yourself are taking every precaution possible so as to not endanger your family members any more than necessary. We are, I can guarantee, going to see a spike after the holidays. It's going to happen. It is my greatest fear about going home for the holidays. It is my family's greatest fear about me coming home for the holidays, about anybody coming in. But at the same time, again, it's been a year, right? And we all have to figure out how to live, and we all have to decide what risks we're willing to take. And we also have to, if we're going to take those risks, we do have a responsibility to mitigate them as much as possible. And so doing everything that you can to try to mitigate those risks by doing everything sensible, right? To avoid interacting with as many people as you can, as much as that really just doesn't feel like right in the spirit of the holidays. It is giving people the opportunity to see more holidays.
Yes. And I think that's a beautiful way to put it. There are a couple of comments of like, just stay home, which for some people is a really good choice. Like that makes a lot of sense. But, for other people, it also makes a lot of sense to see their family members, and everyone is making their own risk assessments and just trying to figure out what exactly is the risk that people are taking. And I think it's sort of a follow-up question, not necessarily about travel, but let's say you might have been exposed. Like, let's say we're actually in person and somehow we got it. I don't know. We're together and we think we might have been exposed. And how long should we wait between when we think we were exposed and when we should get tested for the most accuracy?
So the minimum number of days before getting tested is 3. Before that, you simply have not had the virus in your system long enough to guarantee. You can't guarantee a positive test if you're positive, but you don't have a reasonable chance at detecting the virus before 3 days. I think 5 days is more ideal. The virus onset of symptoms is anywhere from, I did a whole presentation on this at one point. 97.5% will show up by day 11. So if you're going to be symptomatic, 2 weeks is sort of the absolute outside, but it's like 99% by day 12, right? So days 3 to 7 are the days where the viral load will increase to the point where it's detectable. So somewhere in there is your window for getting tested as early as you can to reduce the amount of time that you have to wait before you can interact with people, and reasonably be sure that you've gotten a true negative.
Got it. And even if you're asymptomatic, assume you probably have it and act in that manner.
Absolutely, yes. Of all of the cases that I have, of people that I personally know recently, all of them were from asymptomatic spread or were from that window in between being tested and getting results. People were still doing their normal activities. If you need to be tested, you need to wait for the results before you can go out and do normal activities. It is so dangerous to not wait for the results, and results are coming back so much faster now too. So it's usually a 2 to 3 day wait, if that. So wait for your results, please, please. I beg you, just wait for your results before you go out and interact with people. If somebody in your house is getting tested, wait for their results before you go out. Please. Perfect. That is how all of the cases that I know of recently got COVID themselves. And it is a heartbreaking, and it is infuriating, right? Because everybody that I know was doing everything right. And then somebody else just didn't disclose that they were being tested and that they were waiting on test results. And that's how the spread happened. Yeah. And it's so frustrating and it's so painful. And it's super painful for the person who ended up being positive, right? Because I'm certain that person thought, for sure, I'm negative. This is just a cold, just allergies or, whatever. And it's very heartbreaking to be the person that caused somebody else to get a disease and potentially to get a fatal disease.
Absolutely. Absolutely. So I guess maybe to spin off to vaccines. So question, sort of like, when will this all be over? So when a vaccine comes out, is this going to be a vaccine where it'll be something we think we're going to have it every year, kind of like a flu shot? Is it something that will just cure it? What is sort of the ideal scenario and what's being sort of talked about of what it could be?
I mean, so that's an excellent question. And I'll start that by saying that vaccine campaigns are intended to eradicate diseases. So the reason why nobody gets smallpox vaccines anymore is because we eradicated smallpox through vaccination campaigns. We have very nearly eradicated polio. We're hoping that is the next vaccine preventable disease that will be eradicated. We're having some trouble getting the proper uptake we need due to some anti-vax campaigns and some interesting actions by some foreign governments in other countries. But if we're looking at a vaccine for coronavirus, it's hard to say what it's going to look like because we have not had previously a human coronavirus vaccine for any of the previous coronaviruses that have hit humanity. We have had a vaccine developed for chickens. There's a chicken coronavirus. And that vaccine is not the greatest in terms of efficacy. So what this vaccine will look like depends largely on the efficacy of the vaccine. So if you think about the annual flu vaccine, which is, a multi-hour conversation in and of itself, but to put it very briefly, the annual flu vaccine is determined or designed before flu season starts so that people can get the vaccine. Please get your flu shot. just please do. Yeah. And it has a certain efficacy. And in a good year, you're looking at 60, 70, 80% efficacy. If you get it and you get exposed, there is an 80% chance that you will not get the flu. In bad years, that's a 30-ish efficacy. And that can be very frustrating for people whose the majority of our interactions are with the flu vaccine, right? That's what we normally interact with. And if it's not perfectly efficacious, why are we doing this? One thing we do know about the flu vaccine, and that I would anticipate from a coronavirus vaccine, regardless of its efficacy, is that getting the vaccine reduces the severity of the illness.
Great.
So even if the flu vaccine doesn't 100% work on you, if you get your flu shot, you are exposed to flu and you get flu, your case of flu is likely to be far less severe and much more survivable, because flu does kill people every year. Now, when we're looking at the coronavirus vaccine, depending on efficacy studies, we'll hopefully know that early on. We won't know 100% how long the efficacy will be. There will be a cohort of people that will be constantly getting titers to see how long it persists. So you could be looking at a vaccine that you need every year. You could be looking at a vaccine that you need just once. Okay. If we did a global campaign and we're super effective with it and we were able to eradicate this disease entirely, the only question about the disease recurring is whether or not it recurs in the animal population, because it is a zoonotic disease. Right? It jumped from animals to humans, or at least that we're like 99% sure that's what happened. And so if it comes from animals to humans and there's an animal reservoir, like rabies, think of it like rabies, right? There are animal reservoirs for rabies. Now, spread from animals to humans is not via casual contact. You don't get rabies from petting a dog. You don't get rabies from a dog sneezing on you. They have to actually bite you, right? Anything that's infected with rabies has to actually bite you. And so because the spread of that is so rare and the cost of the rabies vaccine is so high, we really only vaccinate people who are likely to get bit. So veterinarians, animal control folks, that kind of thing, right? However, and the other reason why we do that, I want to make sure that I make this clear. The incubation period for rabies is so long, it's 6 months plus, that if you get exposed to rabies, you have time to get the post-exposure prophylaxis, which is essentially a vaccination to prevent you from getting the disease. So if just public service,
thank you.
If anybody gets bit,
public service,
please go just get your rabies prophylaxis. It will save your life. Rabies is a 100% fatal disease. But so going back to the original point, sorry. If it does persist in an animal reservoir, then this is something that we will have to have on a regular basis as determined by sort of titer, right? So titers are, it's a blood sample, and they basically measure the level of antibody in your blood, and they will know sort of what level is protective. And if you go below that protective level, then you need to get a booster shot. And so it's difficult to say at this point what that's going to look like. Everybody is really scrambling to try to get an effective vaccine just developed. It's an absolutely insane effort that's being made by everybody who's working on the vaccine right now. All my friends who are in vaccine work, I haven't heard from them.
Of course.
They're
doing a lot.
They're insanely busy. And there's also the question of where it's going to come from, right? So most of the world is currently invested in something called the Kovacs Facility. And what that is a group of, it's at 184 nations right now that have all invested in the development of vaccine. The more developed countries have invested a lot more than the lower developed countries. But what it does is it guarantees equitable and affordable access to all countries. And this is really important, because if we vaccinate an entire country and we don't vaccinate the neighboring country, you really have not done a lot to protect the first country, because once those titers start to go down, and we don't know when that will happen yet, anybody who crosses that border could potentially start spreading it and could potentially sort of restart the spread of the disease in the original country. right? So making sure that we get everybody in the world vaccinated is vitally important to stopping the spread of this disease. The United States is not currently a member of the Kovacs Facility. So it's really an interesting question to see how this will all play out in an international sense when the first vaccine is developed, and how that will be distributed. That's still a pretty big question for a lot of us.
It's huge. And then, especially because the US isn't part of this larger cohort, is there a plan in place to get the vaccine within the United States to the people and populations that have been most impacted by it?
That's a very good question.
Or I guess maybe in an ideal setting, whether or not it's been formed. In an ideal setting, is there a way to make sure that groups that have been, the elderly, we know that it's really had an incredible impact on communities of color. We know this to be true based on metrics, right? Yeah. And a lot of factors contribute to that. Is there a way to make sure that the communities that have been most impacted are kind of like the most resilient going forward? Is there a way to make that happen?
So this is a policy question. And the interesting thing is, when you are in an administration that is very pro-business, that is very pro sort of the bootstrap theory of sort of personal responsibility, you don't often see administrations like that think about sort of equitable and effective distribution in the same way, right? It's available. It's entirely possible that the development of this will lead to a federal buy of the vaccine, and that will be free or incredibly cheap to people. That's entirely possible. I'm not privy to the administration's current plans. So I want to make sure that I'm not speaking positively or negatively for this administration, right? I don't know what their current plan is. This becomes more complicated if the first vaccine is developed outside of the United States, because if it's developed by a Kovacs Facility nation, which very likely to be if it's not in the United States, the question becomes, how does the United States, as not being a member of the Kovacs Facility, even gain access before those other 184 countries, or at the same time as those other 184 countries? And if not, then we will be sort of last in line.
Got it.
And if that's the case, then we will be dealing with the pandemic longer than everybody else, which will have some pretty serious repercussions on all of us. So that's a scary thought.
It's a really scary thought. And, ideally, let's pretend we're all in the process of getting the vaccine and we're all working as a team, right? Like the whole world is coming together, and this is wonderful, but still it takes time, right?
Yeah, it does.
So kind of within that time, how do we know when we don't have to wear our masks anymore? Like, what has to change I know that there's kind of, people keep talking about like there's no normal, isn't going to be the same normal again. But, when can our bubbles really expand? When will we see a movie of a large group of people? And I have a little bit of internal freakouts when I see like huge crowds together. Like what will it take to make that possible again?
So it does take, I know that there's been a lot of talk about herd immunity lately, and I understand that is a difficult topic to necessarily address. I will first say that one of the best sources of information on herd immunity is there are probably 3 or 4 recent articles written by a scientist at Hopkins named Gigi Quick Gronvall, Gronvall. And I highly recommend reading her writing on herd immunity to sort of understand what it is and understand how it works. The short version is, if you imagine a herd of cows, or any animal that you like to imagine herding, but imagine a herd of cows, and you imagine that one of them has paint on its nose. People hang out with cows. Cows like to kind of move around and stuff. If you imagine that cow then goes and like boops noses with another cow, and then that cow goes and boops noses with another cow. And now let's imagine that this paint is watercolor, right? We'll play with chemistry for a minute. Imagine that the vaccine is like a sheen of oil on a cow's nose, right? So if the first cow goes and boops noses with another cow, and that cow has oil on its nose, the watercolor won't transfer, right? Because oil and water don't mix. So imagine how many cows you would have to cover noses with oil to prevent that first cow from infecting another cow, right? So if you just sort of imagine this is like a game of Pong, where cow then becomes like the new Pong. I'm really mixing my metaphors here.
It's late in the evening, and it's
Sure,
still working really well.
Great. That's what herd immunity is. And in general, sort of the rule of thumb is that it's somewhere in the area of in the range of 95%. Right? If you 95% coverage, you have to have a lot of coverage, right? And this is why scientists are not wild about the idea of using herd immunity to deal with the virus. And I will also note, just as a side thing, that the notion of using herd immunity presupposes that once you've had COVID, that you are immune forever.
Can we talk about that?
We already know that you're not, right? We've already had one confirmed reinfection with a new strain. So we know that it doesn't last forever. We don't know exactly how long immunity lasts. I understand that uncertainty is terrifying and very upsetting. It's upsetting to scientists. We like to have answers. That's why many of us became scientists, right? But it's so important to understand that relying on just spreading the disease as far as we can and just dealing with it is not a strategy for containing a disease. Herd immunity is something that we use when we're talking about vaccinating and ensuring that you're vaccinating enough of the population. And generally those who are not vaccinated in the population that fill that 5%, we're talking about people who are compromised, people who are allergic to vaccine ingredients, people who have, for one reason or another, adverse reactions to a vaccine, which is an infinitesimal percentage. It's like 0.0001% of people will have, for your typical vaccine, will have a reaction. It's very difficult, if not impossible, to predict who will have that reaction. But if people have had a vaccine reaction in the past, we tend to not recommend that they get vaccines again in the future because they can get worse, right? So that's what we talk about when we talk about herd immunity. The amount of time that it will take if we develop it in the United States to get to 95% coverage, 6 to 12 months.
Okay.
Right? Because the manufacturer has to make it, and it does take time to make a vat of vaccine. I actually wish that
hundreds of millions of them too.
Hundreds of millions of them, right? 330 million doses. I actually have a friend who used to actually be one of the people that made vaccines for, I want to say Merck, and talked to him one time about the whole process and how long it takes and the quality control measures that have to go in. This is something you're injecting into human bodies, right? You can't just sort of mix everything in and kind of
see what happens.
Controlled, very careful process. It has to be safety tested. Lot numbers have to be made, all of that stuff. So it takes a long time to ramp up production of the vaccine, to roll it out, to distribute it, and to give it to everybody. So best estimate, 6 to 12 months after development and confirmation and approval of a vaccine.
Got it. And how do we know it's safe?
So vaccines, this is such a great question. Vaccines go through vaccine trials, right? So there are multiple phases, and one of those phases is actually a safety trial. So healthy people, and this is true of any drug, right? But healthy people are given a vaccine, and then we just kind of watch them to see what happens. And they're consenting adults. They know what they're doing. I actually met somebody who had volunteered for one of the COVID vaccine trials. And he was doing quite well and was very excited about being part of the vaccine trial. But we literally do studies just to make sure that it's safe. Before we even do anything on efficacy, before we do anything else, we just make sure it's safe in healthy people.
Mm-hmm.
Right? We don't go around injecting immunocompromised people with experimental vaccines. That's not a thing that we do. But in a population, hopefully representative population of healthy people, we test vaccines for safety first, right? So even in an abbreviated or accelerated testing, as you have in COVID, we're still going to have safety studies. Those will be published, right? And so I highly encourage, if anybody has scientist friends, if you are concerned about it, looking at it, vaccines are required by law to have inserts, and they're very thick, folded up pieces of paper with very tiny writing, but those have the safety and efficacy studies in them, right? They have the results of those in them. And that is a very important thing, right? People have died for these regulations to be in place. And it is very important, if you are concerned about it, you can look those up online before you ever get the vaccine, right? Yeah.
Yeah. And it's kind of a reminder, for myself, for everyone, the reason why it's taking so long is to make sure it is safe. Yeah. So even if the actual vaccine that's going to be released 6 months from now, a year from now, who knows, might actually exist, it's going through the process of making sure it's okay to actually take, because no one wants someone to take something that's dangerous to even start with.
Yeah. Okay. Last time I checked, there were nine potential vaccines in development that are in testing. And there are currently 2 in the United States that are in the final stages of efficacy testing. So it is possible that in the next month or 2, we will see a vaccine being approved. Potentially by the end of the year. That is what the administration has said. That's their goal. I fully support this administration's efforts to get a vaccine out there and to develop one. And if the safety studies come through and they are good, and the efficacy studies come through and they're good enough, I'm honestly okay with it not being the greatest. We will continue to work on it, but getting it out there is going to be very, very important. Absolutely.
Great. Well, Taylor, thank you so much for spending time with us and talking about, from voting to the vaccine. And I think I'd like to leave it on everyone who has the ability to vote. Please go and vote, whatever you might be doing. And if you can help someone to vote, by watching their kids or, taking on a task at work or something like that, please make it easier for other people to vote as well. And as you mentioned, wearing a mask is not about politics. It's about public health and us all taking care of each other. So thank you very much.
Thank you so much. Everyone, please vote.
Great. Thank you.